Faster, faster, faster. Wait. Is faster more efficient always better in medicine? For doctors? For patients? Not so sure, huh? Stick around to hear how slowing down can actually help you personally and professionally. Thank you for joining me here on another episode of the MedEdWell Podcast. We're already to episode 19. I appreciate all of you who have tuned in, listening, sharing, and reviewing this podcast. Today we'll be talking about slowing down and how that can help your wellness. If you want to get home sooner to be able to slow down outside of work, check out my free guide, Maximize Your Clinical Efficiency, my 10 tips to get stuff done and to be able to get home faster. You can head on over to mededwell.com/efficiency guide. And please send the link to your colleagues since I know I'm not the only one out there who wants to get home sooner. Before we dive into the rest of today's episode, let's hear from today's sponsor. The White Coat Investor has been helping doctors and other high-income professionals with their financial literacy since 2011. They have courses on financial literacy, physician wellness. I personally took the Fire Your Financial Advisor course, which not only increased my financial literacy, but it also taught me how to interact with financial professionals, things I needed to know about financial plan, doing estate planning, just those general things that you otherwise aren't taught along the way. You can head to mededwell.com/WCI to find out more. All right, now back to today's episode. Life moves fast. We all feel it these days. The online news cycle, social media, some of the conveniences, online ordering, things getting delivered. More, faster, cheaper, more efficient. There's more events on the calendar, more activities. And many of these things we kind of put on autopilot, doing things almost without thinking. Getting home from work, making turns automatically. You get home sometimes and realize, how did I make all those turns? You may experience similar things clinically when you see something, say it's red enlarged tonsils with a exudate. It might be strep. You may still get the swab, but you know what it probably is. Daniel Kahnemann and Amos Tversky's research was compiled in Daniel Kahnemann's 2011 book, Thinking Fast and Slow. It goes over two different ways or modes of thinking. System 1, which is instinctive and fast, and System 2, which is slower, more logical and deliberative. We all live with both of these systems and use them at different times, but having a framework to fit some of these ideas into can really help in considering how you make decisions. So, for instance, getting home from work for the 100th time, not really realizing how you made it there, that's going to be System 1. Then performing a procedure, especially the first few times, it's going to be more System 2. You're going to have to stop and think about it a little bit more. The speed of life these days, and the speed of medicine, pushes us each towards System 1 thinking. And in many ways, this is necessary. We need these heuristics and patterns to recognize those things that we get good at. And yet, sometimes we need to slow down, to do some System 2, deliberative, analytical thinking. So we're going to go over two ways in which this is applied. First, we're going to talk about how slowing down personally has benefit for you. And then we'll go over professionally, how slowing down can not only help you, but also your patients and your connection to the practice of medicine. So first, slowing down personally. It involves creating that time margin, like we talked about back in episode 4. It means saying no to certain things, both personally and professionally, whether it's extra committees, the extra sports team. It's not saying one thing is right or wrong for you as an individual, but you can't do it all. So some of these things will be unique to you. So saying no, and then when there's that space on the calendar, don't fill it all back up. It's so tempting to say, oh, there's something else that we could put in there. But as your schedule says, time slot available, you could use that margin intentionally. Whether that's for rest, taking some time to reflect, maybe on your priorities, the direction you want your life to be going, the trajectory that you're currently on, and whether you like where that will take you in 1, 2, 5, 10 years from now. It may mean that you schedule some intentional time with family or friends, that you schedule some rejuvenating activities, exercise, hobbies, something else. It could be meditation, mindfulness, or spiritual practices. It involves thinking and making decisions in line with your priorities. So for me and my family, 2020 was a year of change. Not only the COVID-19 pandemic, quarantine, and many things being virtual or postponed, but the birth of our daughter just before the initial shutdowns also led us to some of these intentional choices that we had to make as we went from no kids in the home to a newborn baby. Certainly a wonderful gift to our family as it grew, and we took advantage of this opportunity for quality time as a family with more space on the calendar for a while. So slowing down personally, it involves creating time margin. It involves saying no more and not just filling the calendar just because. And then finally, using that margin intentionally. So first we had the use of time and slowing down in a personal sense. But then number 2, slowing down professionally. And again, this can mean a lot of different things to different people. It certainly means creating margin, that's saying no to certain things, whether it's the compensation committee, retirement plan oversight, the quality team. Maybe it's asking to coordinate something. Maybe this is an opportunity for you to build community among your colleagues and staff. But maybe it's just something extra that you just happen to be someone who usually says yes. So you're going to have to choose whether you want to participate or whether you say, no, thank you. You have to figure out what's your capacity in this season. So slowing down may mean saying no to certain activities or certain additional responsibilities that you may have some say over, especially if you're an employed physician. It could even mean cutting some FTE in your job, saying, I'm only going to work this many shifts a month. I know it's going to come with some financial implications, but I'm willing to do it. And I know where my finances are so that I can make that happen. So slowing down professionally at the macro level includes these big commitments, but it also involves the day-to-day workflows. Bringing it back to Kahnemann and Tversky's System 1 and System 2 thinking, there are more applications. As a physician, we are trained to work hard. A lot of it self-selects those who are go-getters, working hard, want to take great care of their patients. We know what to do, and then we go do it. Yes, thinking about it, but often with quick decisions. Order this, diagnose that, communicate, hey, you can discharge that patient, if you could bring an extra cup of water to this other patient, or the family's here, if you can call the social worker. that'd be great. Again, it's about action and doing. You just can't stop and deliberate over every little thing. The learning and deliberative thought that often is part of how we go through our days is more system 2. It takes a little bit more thought, a little more reasoning. It's in contrast to that system 1, just going for it, those heuristics, I know what to do. The system 2 thinking helps us formulate illness scripts, these patterns. We often find ourselves looking at illness scripts and patterns that help us understand what we're seeing. But sometimes overusing these heuristics in the system 1 or automatic thinking, we risk confirmation bias and premature closure as we consider a clinical scenario. These mental biases and errors are often discussed in morbidity and mortality conferences, and were in my residency as well. The current pace of medicine is often so much about speed and efficiency that these risks remain. It's not that they can necessarily be all explained away by how we change our thought process. And though system 1 is necessary, at times it can be a potential barrier, potentially problematic. But how can you incorporate more system 2 thinking into your medical practice? Could be writing out your differential diagnosis. Could be talking out your thought process with a colleague or even with a patient. I think this particular diagnosis is more or less likely because of whatever your symptoms are that are more reassuring. I'm still thinking about what all this could be. Certainly the differential that you discuss might be shorter than what you're actually thinking through. It might be longer when you're doing academic teaching rounds, which teaching can be its own more thoughtful and analytical process. But you might not do all of that in front of your particularly anxious patient, who might then latch on to something you said and say, my doctor said it could be this. But when families are worried, especially about cancer, I go ahead and say, I know sometimes people worry this could be cancer, and then share about what test we might do or why their clinical picture is more reassuring, or what we'd watch for if things were to change. Dr. Google is going to say it, so slowing down to acknowledge these things, this allows the patient an opportunity to feel heard. Gives me a chance to say, what else could this be? And am I missing something? So I want you to pause for a moment and reflect with me. Say to yourself, what if I did this? If I slowed down personally and professionally? Would I have more margin on the calendar for rest, self-care, time with family or friends, to take up that hobby again? Would I feel more peaceful and satisfied with how I use my time, how much I'm working? Maybe slowing down periodically at work could allow me to find more joy in connecting with patients, the opportunity to think clinically. I really enjoy those moments when I get to use those skills that I went to medical school for. So take that scenario, how things would look or feel for you, and let it spur you to action this week. It could be saying no to that committee. It could be putting a date on the calendar, time with a friend, significant other, or a child. It could be downloading my free PDF guide, Maximizing Your Clinical Efficiency, with 10 steps to get stuff done. Why? So that you could have the margin to slow down and get home sooner. So go to the link in the show notes and download that today. Check out a White Coat Investor course for more lectures on financial literacy and physician wellness, and take that next step in your wellness. I want to thank you for joining me here today on another episode of the MedEdWell Podcast. Please subscribe to the podcast and share with another physician today. I know these things have been really helpful for me to go through, and I hope they've been helpful for you. Share with a friend because this is too big to ignore. We need to support one another in promoting physician wellness. Help them, help me, help us take that next step. Until next time, keep up the good work. Thanks for all you do, and have a great day.